and thousands of years, people have been receiving nursing care. And it may not be by people called nurses, but the care that we deliver will always be required. And it's probably been around 150 years in Australia that nursing is as we know it. Next year will be Florence Nightingale's 200th birthday, so we know modern nursing is 200 years old.
Kylie Ward, the CEO of the Australian College of Nursing. So Kylie, tell us a little bit about your role.
I'm absolutely privileged to be a leader of the nursing profession. The Australian College of Nursing is the preeminent and national leader of nursing in Australia. We're the member of the International Council of Nursing. So we oversee 390,000 nurses in Australia and then have a global connection.
That's fantastic. So how will informatics and AI change the way that nurses operate on a day-to-day basis?
In a couple of ways. The nursing role itself, the World Bank has come out to say that nursing is one of the top 5 guaranteed professions or jobs of the future. The nursing role itself has so much human element to it that probably 85% won't change with AI and innovation as we go forward. But for nurses themselves, what we have the capacity and capability to do is use technology and use the best of artificial intelligence to be able to connect and communicate better with our patients and provide access. We at the Australian College of Nursing have a community of interest called Nursing Informatics, and so for our nursing informaticians, they're very much on the ball. They're rolling out electronic medical records and other initiatives. So you've got system-wide initiatives and then local initiatives.
So does that make the day-to-day of a nurse a lot busier?
Yeah, it certainly does. What we have is a more informed consumer, and a consumer, whether that be a patient, a client or a resident, should be able to access. So people are getting online, learning more, wanting to know more, and I think as the generations change and the expectations increase, for a nurse it's how do you use the tools and the tablets and the point of care solutions to enhance a better experience for our patients and the communities we serve. It also gives us access to great information. For the years when I started training, you had to remember everything. So it's nice to have software that's easily accessible. But most importantly, for vulnerable, disadvantaged and isolated communities, to be able to have innovation where we can get into their home and observe them taking medication or be able to ask questions without physically being there is a game changer. If we don't claim where we are, what we do, and the influence that we make in terms of outcomes, what will happen if we're not around, if people don't want to be nurses? And so it's worth thinking about. Nursing care will be delivered, but by who, and what will happen to the nursing profession?
What are some of the areas in policies that the nursing profession needs to change?
There is nurses work every day, all day, everywhere in healthcare settings. And there's some areas that are particularly important to the nursing profession, certainly aged care, chronic disease. We need to look at workforce sustainability. It is anticipated that by 2025 we'll have a workforce shortage of 80,000 nurses, and by 2030 125,000 workforce shortage if we don't do what we need to now. And certainly areas within ageing and end-of-life care. So we're looking at all of those areas for policy. Last Friday we released a white paper calling for the regulation of the unregulated healthcare worker. They make up 70% of the aged care workforce. We're very concerned that this vital and important worker isn't protected, and that there's elements around safety and governance and education. So nursing is absolutely key to influencing policy and for advocating on what is in the best interests of the community if they can't do it themselves. So we actually have, we called with the Minister, announced at the end of last year the Nursing Minister's Trailblazers Award. It's the first time in Australia's history a Minister has given an award. And what we're showing in those awards is nursing trailblazers, nurses who are influencing models of care and putting in initiatives that can be rolled out across the country that are game changers and showing how nursing can make a difference. And our finalists, we have 4 finalists for our Trailblazers, and they will be presented at the launch of Nursing Now Australia in Sydney on the 9th of April, which is a global campaign to acknowledge nurses' contribution. And we'll be highlighting and showcasing the work that nurses do to influence policy and to advocate for the best interests of patients and communities everywhere.